Okay, so we want to give you a little bit of background about who we are. So we are the Clinical Effectiveness Group. So we are GPs, analysts, data scientists, and facilitators based at Queen Mary's University of London. We have access to primary care data across all of North East London. We build dashboards, searches, software tools for GP teams and NHS commissioners and public health. We have facilitators and support officers who support all the practices in North East London. And we publish research of national and international significance. We are funded by the NHS and the local authorities in North East London and research grant. Next slide, Tracy. Okay, so today what we wanted to cover is CEG Smart templates, how they work, and we'll do a live demonstration on 3 of our main templates on System 1 and on EMIS. Also the importance of using the templates. Practice support searches. We'll briefly go through support searches and where they are and how you can access them. And we'll demonstrate the APL tool, mainly the child immunization recall tool. I'm now going to pass you over to Tracy.
Thanks, Ranjan. Okay, so we're going to get started with templates. It seems to be very confusing as there's so many templates out there. You may be unsure of what templates to use. So that's why we've put this webinar together so we can go through and so that you know exactly what CEG templates you need to use and for which areas. The main template that the majority of you will be using would be our long-term conditions and LIS template. So it's LTC and LIS, as this covers things such as your CVD and your diabetes. Also, it has your local incentive scheme information in there as well, which covers your asthma, your COPD, cancer care reviews, which is just to name a few. The template also covers your QOF domains. So it covers all 3 areas, your LTC, your LIS payments, and your QOF payments as well. These are available in both systems, so for EMIS and System 1. And this is the name of your LTC and LIS template. So LTC and LIS, BHR, CEG. They will have a version number on them, but the version number is subject to change throughout the year whenever we make any updates. So how do smart templates work? Well, they customize to each individual patient that you have in front of you. And that's by, in the background, it's using visibility rules. And you ask, what is a visibility rule? So a visibility rule is if a patient is on any of the QOF registers, so say, for instance, they're on asthma, diabetes, and the heart failure register, when you open the smart template on the patient, it will only open those 3 relevant LTC pages. You will see other pages, but it's just these 3 that will be the main LTCs. If they have multiple more, if they're on 5 or 6 different registers, then you will also see those registers as well come up. So here's just a screenshot of what it looks like within the EMIS system. It's all on your left-hand side. So here you can see you've got the different pages. The ones with the stars are going to be your LIS or your QOF domains, so the LTC registers, and the rest of them are your generic pages. It does have a slightly different look within System 1. In System 1, your pages are along the top, and they are highlighted if the patient is on that register, because at the moment they are all greyed out. So this is a very different view to what you see in EMIS. So what I'm going to do now is I'm going to do a live demo for you in EMIS on the LTC and LIS template. As usual, EMIS never likes to play ball straight away. Okay, so here is what it looks like within the clinical system. You have your main page here, which has got the CEG information at the top. And if you scroll down past these parts, these blue lines here are just telling you what patient, what QOF register the patient is on. So as we're using a dummy patient, we've opened up quite a few of the pages, so we are able to demonstrate this for you. And if you go down, you've got your consent is on this page. And then also it's got a brief examination part. So this will be so that you can quickly do the examination part, your blood pressures, your pulse rates, your height, weight, and BMIs. This examination part will also be on your individual LTC pages as well. Then you've got your LIS information page. So this will tell you all the information that you need for the current year's LISs. It breaks them up into the different aspects of it. So currently we do have the AF LIS. So you've got different elements there. It'll tell you exactly what you need to do for payment. And also if there is quality indicators on the LISs, which you do have on some of them, it will also list it here. So if you do forget throughout the year exactly what you need to do for a certain LIS, just pop onto this page and it will tell you. Just scroll down, you've got your respiratory. So your respiratory is the ones that has the quality indicators in there. So that's listed. We try to bold the payments so it stands out a bit more, because if you don't have time and you just quickly want to look at it, you can go on there. You got your diabetes as well, your injectable therapies. And if you're within Redbridge, you have your end of life care. You've also got a separate lab results page. And on here, you'll see that there are stars next to some of the information on here. And this is to indicate for your LIS or your QOF. So if it has a star next to it, that means that you need to have this recorded within the financial year to receive your payment. You can see your serum cholesterol has got 2 stars, so it is a part of your LIS, whereas your serum LDL and your non-HDL is 1 star, so that is what you need to record for your QOF. This has got your basic lab results on here, your full blood count, your USNEs, your liver functions, TFTs, and the clotting screening part, which is applicable for your AF review as well. I'm going to jump on and demonstrate the diabetes page for you. Okay, so currently the way we have the template set up is so that on each individual LTC page, you do have your QOF information at the top, as you can see here in the purple. But this will be changing. This will change, so it will become a standalone page on the left-hand side, and it will have those visibility rules on. So on that page, we'll just bring up the QOF registers that the patient you are seeing in front of you is on. You won't see all of the LTCs on there. So like I said, currently the view you'll see is this, where it will give you the information at the top. It covers different aspects on this one. You've got your annual review done. You can see your patient diabetes care plan, and within the templates you do have sections where you can free text information. So you just tick your box and then click on the text box and write in whatever information it is that you need for that patient. You've got your lifestyle intervention pack. So as you can see here, it does have the 2 stars as well as the smoking. So that is part of your LIS requirements. You've got your examination part. As I said, it would still be there in all of your different LTC pages, as well as being on the main page. And highlights your LIS targets as well whilst we are there. You've got your advice and planning section. Again, if you need to do referrals, you can do that from the template. If they decline to have the referral done as well, just make sure that you're recording all of your declines. So even as a practice, you will know that it's not something that they wish to do. You've got different aspects. You can do the patient advice to inform the DVLA if they're no longer able to drive. You've got your treatment and history page. Again, if they've had any hypos, you can add this in here, which gives you the diary entry. More QOF information there for you. You've got your patients on the SGLT2 medications in here. And you'll notice you do see blue highlighted letters, wording here, sorry, and this is a hyperlink. So if you click on this, it's going to take you to the internet, to the relevant page that you need. So it's trying to make everything easier for you. All of the information is all in one place rather than clicking out and trying to have to find the information yourself. You've got your diabetic foot exam, which is required for your 8 care processes on your Liz, as well as you do need to do parts for your cough on the feet risk there. It also covers your depression screening, patients that are on an ARB, ACE or statin as well, retinal screening. So with this, we do always advise it is not part of your 8 care processes for payment, but the ICB do look at this for quality purposes. So do make sure if you're referring them that you do put the referral down, and then also in return of that, when they've been to have their retinal screening done, that the information is put back into EMIS to say that they have had that done, whether it be within the year or we currently are in the transition to do it every 2 years. And you'll see you do have your diary entries, so you can add the date in. And then also you can put in for when they need the follow-up done. So your diary history, just make sure that you're putting it for a year or 2 in advance, whatever is applicable for that patient. Then you've got your visual acuity, your retinopathy, cataracts, glaucoma, and you've got your CVD risk here, which is a part of your 3 target treatments. You must make sure that if the patient has started on a statin, that you click the statin offered button. They must have the statin offered button as well as having the statin issued. You've got your Q risk section as well, which currently for Q risk 3, it is an online calculator. So again, like I said, if you click on the link, you go to the web page, you work out the calculation score, you come back in and enter it in here. If you are using the Q risk 2 score still, always just make sure you click your calculate button so that it does record the information on the right hand side here. And on the right hand side, you can see any information that's previously been recorded. You'll see the most recent entry here. But if you do click on your arrows, it will give you the list of where they've had it done multiple times in the recent history. And then down the bottom, you have got your follow-ups. So if you're doing your diabetic annual review for a year's time, or if they need a blood test, say, for instance, in the next 3 months, you can use your diary entries down here to record that. That's your diabetes page, and then I'll briefly just go on and show you our asthma and COPD page. The test patient that I have only has COPD. They don't have asthma, so I'll only be seeing the COPD page on here. Again, it works exactly the same as the diabetes. You've got your cough information up the top here, and then it just goes through and you have your annual risk review, your MRC score, which you need to do for your cough. You've got your management plan, which needs to be done for your Liz's. And with this, the COPD patients have to have a management plan done, whereas your asthma patients can decline to have their management plan done. So always make sure you're using this box to record it. Then you've got your CAT scoring, which again is part of your Liz payment. And with this, it's just making sure you're clicking the calculate button down the bottom there once you've entered your figures in up the top, because we do get busy and we get sidetracked, and sometimes you may have entered the information in here but not pressed your calculate button. So just always make sure that you've got your calculate button done. You've got your inhaler techniques as well, that's on there. Further investigations and some results. So if you do need to do referrals for spirometry, that's in there. Also, if they need to have the post-bronchodilator spirometry done as well, all in one template. This is a really good template to use. Then this way, you don't need to be using multiple different templates to record the information, because it's all in one template for you. And here is your additional and the quality one, as I stated, for your respiratory Liz, where they are looking at quality information. That's under this section for you. And then you've got depression screening and smoking status. as well as vaccination status, because that is a quality part. Now, let's a quick look at one of the LTC pages. On your left-hand side here, from BP at home monitoring, everything below here is what will show up on all patients. This has no visibility rules on it, apart from the cervical smear page. That will only show up on your female patients. But you have access to your carers page. So if you are needing to add carers information for the patient, you can put that in. You've got your adult immunizations, your depression screening, so your PHQ-9 and your GAD-7, your lifestyle intervention page as well, which I know a lot of you nurses and HCA use because it covers your smoking, your diet, your alcohol. That's all in one place. And again, that's got the links on there, which if you need the extra advice is going to take you to the internet. Ethnicity, if the ethnicity happens to be missing when you're seeing that patient, you can record that here as well. And then the one that most of us like come the end of the year is you've got your QOF PCA pages. So this will be your exception reporting. And again, this does have a visibility rule on it. So it will only bring up the registers that are needed for your patient. You will not see all of the long-term condition PCAs on here. You do also have a treatment and over-the-counter page as well. So if you do need to use that, you can on there. And then lastly, we do have a dashboard page for you. You can see you've got IIF, you've got your SMI, your learning disabilities, you've got cancer screening and care homes. And this will take you to our website. So if you're unfamiliar with using dashboards, this is a good way of firstly getting to it, because if you don't know the details to get onto the website, if you click on these links, which I will show you the care home one, this is going to take you straight to that dashboard. And it will give you the main information on the front there as to what it's reporting on, and then it will give you your different KPIs. So then you can see as a practice how you're doing. I will just say this data is run once a month, and the dashboard is produced in the middle of the month, roughly by about the 15th. And it's also good so because you can then see how you're doing in comparison to the other practices within your PCN. So just so that it's on your radar and you know how you're performing in comparison to the rest of your PCN, because you do have PCN targets as well as practice targets. So if you do want to access any other dashboard, please do contact your local facilitator and we can give you the login details for the dashboard website. Okay, so that's your LTC template. I'm now going to jump into System 1 to show you the women's health template that we have. So this is a good opportunity. If you've never worked on System 1, you will be able to see how your colleagues that work in System 1 view the template and vice versa. So your women's health template, again, on your main page, covers your examination. And for the CMIS users, it's going to be a completely different view to what you're used to. And so you've got your examination pages here. You've got your risk scores. And again, it works the same as it does in EMIS. If you click on the link, it's going to take you to the website just like it does in EMIS. So that's your main page. Then you've got your abnormal uterine bleeding, your chronic pelvis page, your polycystic ovaries page, premenstrual disorders as well. And what happens with this, again, it works the same on the right-hand side, that if there is any information previously recorded for the patient, it's going to show up here for you. So you've got your histories in there, your examination findings, investigations to request, and any management needs as well. We try to give as much information, as I've said previously, in the template so that you're not having to go to other sources to try and find this information. You've got your chronic pelvic, and again, within System 1, you tick the box, and then that's after you've saved the template is when it would record here on your right hand side. You've got some red flag symptoms for the chronic pelvic page. An examination, again, it works exactly the same in system 1 with the examination pages. Although it is a standalone one in your LTC, it will also be in your other pages as well. Again, you've got your investigations to request the tests, management, any red flags, resources. Again, it's exactly the same, and they are really useful. They take you again to the internet and take you to the page that's relevant to you as well. So you don't have to go onto a website and then try and find the page that you need. It takes you directly to the page that you need. And again, with the system 1, you can pre-type information on the selected areas that's required. That's your history, your examinations, any investigations to request, any diagnosis, management on those, and then lastly your premenstrual disorders. So this one is a good one for the nurses that are attending, because it's all in one place and you can get this all done rather than looking at a few different templates for you. So hopefully I'm not scrolling too fast and you're able to see the information that's on here. Within system 1, if it is relevant, we do add the referral documents within the template if it's needed for that service. So you may come up against that there is a document which you can click on it and it will open up the referral form for you, and then you can add it in. Okay, so that's that one in system 1. I'm going to go back to EMIS now to show you your social prescribing template. So bear with me a second. Social prescribing. So this is for all of our ARRS roles as well that are online today. I'll just go through this. With your social prescribing template, the program requires you on this main page. This is your magic button. So you need to select this every time that you are seeing a patient with regards to social prescribing. Hopefully you are familiar with using this already. And again, it works the same. There's quite a lot more areas within your social prescribing template where you can free text. And it's just because of the information that is required when you are seeing these patients. That's why you have a lot more free texting information within here. You also got your type of consultation. So you always need to select your consultation types. You've got some assessments there as well. Further information about the client again, so it's just talking about their living arrangements, any further care information that they need, their language if that's not already recorded within the patient record, and you've also got your case notes again, which you can type in whatever notes you need to in there. You've also got your reason for referral. So depending on why you are seeing the patient, you've got all the different areas, whether it's the social aspect, whether it's diet or exercise. You can do all the referrals within here. You've got your general well-being, relationships, employment and education. It also covers the financial aspects of a patient's life, as well as the housing and transport. You've got your support offered page as well. So again, it gives you a bit of information up the top there. And it goes into your health support, your personal well-being support, and again, the same ones, relationship, employment, etc. So this is for you to record what support you're offering the patient that's needed. I'll just check some of these. So for instance, if it comes to relationship advice, you might need to refer them to the children's centre, or they might just need a little bit of additional parental support. So you can do all of that from these templates. You've got your personalised care and support area as well. Again, a lot of that is free texting, so you can put whatever information you need in there. And then because you may be seeing these patients more than once you've done your consultation, you have got the conclusion. Because in some instances, there may be long waiting times for some of the referrals that you are doing. So you can make a note of that within this template so that it is recorded. Say there may be a 12-week wait, you can put that in there so you know that you need to chase up your patient after they've had that done in a roughly 12 weeks time. Okay, so that's the demo of the templates for you. I'm just going to go and show you our searches. So we provide support searches for you, and these should be kept up to date by your practice manager or your admin staff or whomever has been allocated to do it within your practice. They are done on a yearly basis, and what you would be looking for would be your practice support searches, and it will be 25-26. And within there, they are separated out into different groups. So you've got your ICB contracts, which will be your LISs, and you will see the how am I doing searches. And then within that, they are your separate ones. So you've got your asthma, your COPD, your AF, and your diabetes in there. You do also have the public health section, which would be your NHS health checks. You've got PCN contracts, which will be things such as the care homes, the IIF, any SMI, the physical health checks, structured medications for our pharmacists that are online as well. Then you've got your QOF and DES areas, and we do also provide the CQRS support, which will help you to do your submissions. And for the nurses, you've got your immunisations and vaccinations as well. So that will cover the flus, the COVID vaccinations. There are some in there for the childhood immunisations. And then there are other ones that we do put in there for you as well. And then anything else that doesn't fit under those 5 criterias will be put into your additional support folders. So if you can't find anything in those 4, always look in the number 6, and then you may find them in there. So that was just a quick brief introduction onto your searches. So that's it for my live demo. So I'm going to go back to your templates. So what is the importance of using CEG templates to record your clinical information? It's to make life easier for you, because if you don't use templates, you have to type in what you're looking for. And as you can see here from this example, just say, for instance, you're looking for diet advice, then you have all these options come up. And you may not necessarily know which is the correct one, especially if it's around payment. You want to make sure that you are using the correct information to get payment. So that's why we suggest using the templates is to make your life easier, and all you have to do is tick the box rather than typing in I'm looking for dietary advice or exercise advice. It's one tick and then it's done. And as I said, that way you can guarantee that you will be paid because you've used 1, the correct template, and 2, you know it's the correct coding that's been picked for either the QOF, the LIS, or the DES as well. So it just eliminates incorrect coding by using the templates. And as I said, with our templates, as I mentioned with the stars, so stars mean prizes to us. So it just means that if there's a star next to it, that's attached to a payment. So all throughout the template, you will notice 1 and 2 stars. Your 1 star is for QOF and your 2 stars are for your LIS payments. And so this just allows you, as I said when I was doing the demo, within the template, if you have any previous entries recorded, it will show on the right-hand side there, as you can see in the blue for smoking status. You can see the last entry was put in on the 8th of June 2020, so that we would know in this financial year that is out of date, so we need to record it for this financial year. And it works the same for your blood tests as well. If you've got a blood test previously recorded, it will also show you the value as well. So there's no need to be going backwards and forwards. It's all showing you within the template on there. And then this just shows you what it would look like in System 1. As I was demoing and we didn't have any patient data, this is from a dummy patient, and you can see I've opened up the smoking status, and on the right hand side you can see that they have previous entries, and that's how you view it within System 1. And then, so with the clinical pathways, this is why we suggest using the templates, because it's only going to show you the information that's needed and a clinical pathway for the patient that you are seeing and the patient that is in front of you. And all of our templates do cover any clinical requirement, whether that be in line with the CEG regulations, your NICE guidelines, and also the government national guidelines as well. The structure of the templates, we try to make them flow in the way that we feel that you will see the patient. So for instance, you will see you have height, weight, and then BMI, so that it flows correctly, so that you're not then having to just say, for instance, you'd added your height and weight, then trying to find, oh, where is the BMI? It could be further down. So we try to keep everything that is required together. We are open to feedback. So if you do feel that something doesn't flow correctly, then please do contact your local facilitator and we can have a look at your suggestions. And then, you know, we can't say that we would 100% make the change, but we will definitely have a look at them, because we do like to make it easier for you. And if perhaps something that we've provided doesn't flow correctly, then please do let us know. We are happy to have feedback on that. So why should you use the CEG templates? It's because it provides the detailed information on all your Lizzie's and QOF indicators. So you know, and you can be rest assured that it covers all information. And as long as you are ticking the box with the stars on it, that the information is recorded. It also standardizes coding. And this also goes in line with making sure that everybody's working the same way. Because if everybody is free texting or just typing in the code, you're picking any kind of code. So it's standardized coding as well as standardized the way people are working. Plus, CEG have also been commissioned by the ICB to provide this support for your Lizzies and everything that comes surrounding with that. That's also will be clear to make sure that you get payment if you're using the template. And we do provide your local support. So from myself and from Billy Joe and from Mevish, we are your local facilitators and support officer, and we can provide you anything that you need us to help you with. Does anyone have any questions at this point?
It was just one question regarding the searches. When are we publishing this year's searches? So the answer to that is we're just waiting for the ICB to finalize this year's specification. Once that's done, we will publish them. Shouldn't be too long now. Another question is, what's the difference between your template and the primary care IT, who have also been commissioned to do templates and searches too? The answer to that is we really can't comment on primary care IT and what their templates cover or why they commission, but this is the reason that this session is quite useful for you to know what we do, how we commission, how you get paid. So I think that question could be for the ICB. Another question is, has there been any changes to the AF list? There is talk on changes to the AF list, and again, we are waiting to hear what they've finalized. So until then, we really can't give you an answer at this stage. But as soon as we hear, please keep an eye on our CEG bulletin, and we'll let you know.
Any more, Ranjan, or is that it?
No, that's it.
That's it. Okay, so I did skip ahead whilst I was in EMIS and I showed you the practice support searches. So I am just going to move on from the support searches. I'm going to pass over to my colleague Mevish now, and she's going to go through the APL tools with you.
Thank you, Tracy. So now we're going to look at the APL tool. What is an APL tool? An APL tool is an active patient link, and it's a software designed by the CEG to display information from patient records held within the practice. It allows you to basically filter and to help you as your teams to review patients and prioritize your appointments accordingly. So we've got currently 5 APL tools, as you can see on the screen. The first one we have is the atrial fibrillation, AF, and this helps GPs, pharmacies, ARRS to review their patients with atrial fibrillation and ensure they are on the safest, most effective medication. Then we've got the childhood IMS one, which helps GPs teams to navigate the complex preschool immunization schedules and protect more children with the timely routine vaccinations. We've then got the NHS Diabetes Prevention Programme, and that supports GPs to prevent type 2 diabetes in their at-risk patients. So it's more towards the invitation and the referrals. You've then got the renal tool, which is, it's there to highlight the critical falls in the renal function, and it helps to manage patients with early or late chronic kidney disease. So it's a CKD one. We've got the cancer diagnosis audit tool, which audits patients with past cancer diagnosis and new diagnosis to identify any avoidable delays. Just to put a reminder on that you've got the audit tool incentive that you've got for Q1 and Q2. The deadline is actually today. So if you want to submit that in today, then you can. And then we've also got the CVD tool coming soon as well. So it's about watching this space. You will be emailed for any new tools that have come out and any updates on any tools as well. Where to find these tools and this folder structure. So I'm going to look at the folder structure first, and then I'm going to show you where to find the tools. So once you requested for the tool via the website, which I'm going to show you on the next slide, the folder structure will look something like this when it comes. It's going to come as a zip file. And when it's a zip file, you need to unzip this file and extract all the whole folder, so that you can access it, because you won't be able to import the search or use any of it unless it's extracted. So the best way to do this is right click and extract all, or you've got the option at the top of the window that will allow you to extract all the folder. So as you can see on the screen, you've got the first 4 folders at the top, which are literally just empty folders. These are for you to use for your outputs to go in. So you can put your outputs in there. And then you've got the 3 at the bottom, which is, one of them is the search. The next one is the tool that I'll show you, and I'm going to do a live demo on this so you'll be able to see it. And then you've got the user guide as well. And that's literally a step-by-step guide. Literally everything I'm talking about today, it will show you that as well, and if not more. How to download it. So the website is on the screen there now. That's our CEG QMUL website. Once you go on there, if you navigate to support for GP practices and go to resources, you've got the software tools there, and then all your 5 APL tools will come up on there. And then if there's any new updates, etc. like that, they'll be emailed to you as well. And if you need any training or anything, my email's on the screen right now. You can email me directly, and we can give you one-to-one training if required as well. Now I'm going to do a live demo. So I'm just going to take over and share my screen. So once you get the APL tool and you open it up, it's going to look something like this. And the first thing you're going to need to do is tell the tool what clinical system you're using. So whether that's EMIS or whether that's System 1. For this purpose, I'm going to click on EMIS. And then the next thing is to import your CSV file. Now, there was a search that was in that folder that I showed you. What needs to happen is, once that search has come through, you need to import that into EMIS and run the search and export the results out. Once you've exported the results out as a CSV file, then you can import it into this tool. So I'm going to just import one that we've got, and this is dummy data from ours. So I'm just going back to my folder, importing our dummy data. So none of these are real patients, it's all dummy data. And then this, you can see what happens. It's going to load up all the patients, as you can see. So now I've got all my patients in, because it's imported it from the CSV file. First thing I would like to notice is that the filtered patients come up as the same number that is run on the search. So you've got 512 patients on your search, and that's what will come up here. So if you remember that number, that is when you filter your patients out using these filters at the top, the number will reduce. So if you want to always come back to your filtered patients, you can reset your filter, and then it will come back to 512 patients. You've got your filters at the top here. So you've got your status one. So if you want to filter by due patients, you can filter by due patients. If you want to look at your 1 week or 1 to 4 weeks overdue, you can filter by that. You've got your age banding. So if there's some HCAs or nurse that I know that like to look at 16 weeks or 12 weeks age band, you can just click on that and that will give you a list of 16 to 18 weeks age band as well. You've got your catch-up one, so your incomplete. So if you like to look at your incomplete vaccination, so 6-in-1, Rota, MB, PCV, you can click on any one or any particular one that you want to look at. You can click on that and that will filter them out towards that. We've got a good one here that's looking at your QOF contracts. So this is a good way to enhance your income for QOF. So basically, it looks at the V1001, V1002, and V1003. And you can click on those filters to bring up your patients for those and see how you can maybe hit your targets a bit more better. On the right over here, you've got your due soon for your 1 year and your 3 years, 4 months as well. So this gives you 4 weeks and it will tell you that they're due soon. That schedule might be changing soon, so there will be an update on that part as well. But for now, it will be those that are due in the next 4 weeks. But just check their date of birth to make sure that it might be a bit sooner as well. But it will just say due soon. You've got your newly registered patients. So if your admin staff want to look at who was registered in the last 2 weeks or in the last 4 weeks, you can have a look at that as well. You've got your individual reviews. So any of the patients that have declined and you want to just see all your declined patients, you can click on that and all your declined patients will come up. And then you've got your flu ones as well. So for your childhood flu vaccinations, you've got your flu record that you can click on. Or if you want to just look at your flu declines, you can click on that and look at your declines as well. So that was the filters at the top. At the bottom here, you can see that it's all color coordinated as well. So anybody that's overdue by 4 weeks or more, it will be in red. You've got the decline contra indicated here as purple, and anybody that's due or due soon, you've got this orange or yellow color over here. And you can see that these are all color coordinated, and you've got the green one that says due soon as well. So the due will be that they're due now, and the due soon will be they're due in the next 4 weeks sometime. You can individually go into each record. So if I go into this patient here, if I click on it, this takes me into that patient detail. So you've got the demographics at the top here. You've got your patient's next appointment that will be coming up here. And you've got the patient's declines as well. So any declines this patient's had, you can put, they're all over here. Then you've got the vaccination schedules and what they've had done. And it gives you the date and the age of the event. And whether they're overdue or not as well, that will come up on here as well. This is quite useful if you need to print it out for the patient as well, because you can export the patient into a PDF and then just click on print and hand this to the patient if you need to. We've also put all the useful links on the right-hand side for you, for all the clinicians and admin staff as well. So if there's any gaps in the childhood IMS or you want to look at the routine vaccination schedules, you can literally just navigate to it from here and it will take you to the link as well. So if I want to go back to my list of patients, I just click on back and this will take me back to the patient. You've got the options at the top here to export to an XML file, which I'll show you in a moment. You've got the export to AccuRx. So if you want to filter out, say, anybody that's due, if I click on that, that will bring me all the patients that are due, and then I can click on export and then export it to AccuRx. And if you want to send an email out as opposed to a text message, then you can send them a batch email to all your patients. You've got your export NHS number as well. So if you want to export your NHS number for any reason. I'm going to show you the export XLS file because there's some use for some admin stuff here as well. So this is what it will look like if you want to export a file into the XLS version. I've exported the 4 weeks overdue. So you can see that these are all 4 weeks overdue. Now, this whole column at the top here that is dark blue or light blue actually is all generated via EMIS and all the data that's been inputted in EMIS. But over here on the turquoise part, this is where you can put in what you need to put in. So if this is the first recall, you can put in first recall. A number of contacts you can put in once, twice, 3 times. They've been contacted by who, you can put your initials and the date that they were contacted. and any comments that you want to ensure. So you can add in whatever comments you want. Note this is not recording on the patient's record. This is recording as an Excel spreadsheet. So then you've got that to hand, and then you can save it in your shared drive amongst each other so that you know that you've done 3 contacts with this patient and you can refer back to it. So that's the XML file that you would export out. What else you can do with this is, as I mentioned, reset filters will reset you back to your 500 patients. And then if you need to clear all filters, you just click on clear all filters, and that will take you back to the original tool that we came onto without any data. And then if you need to run the search again, you can run the search, export the data back in, and then you'll be able to bring up all your patient list. And that's the APL tool. Are there any questions on that? Tracy, I'm going to hand back over to you if there isn't.
Yeah, there's none in the chat.
Okay, all right then, we will start back off again. So I'm going to talk you through our F12 keys. This is a really good function. Unfortunately, it is only available in EMIS. There is no likeness in System 1. So what this is it's a really good function because it tells you exactly what templates CEG provide. So if you're sitting there and you're thinking, oh, okay, I don't know what they provide, or I don't know what template it is that I need to use, this F12 function key is the best thing for you. And that's why we always recommend using it. Please, if you're unaware of how to set it up or you need help with it, please contact your local facilitator. But I will just do a brief demonstration for you of how to set it up. So bear with me a second. So when you're in EMIS, if you just press your F12 key button, find a letter that you have available and then click your add. This view is going to be different to the view that you see, and that's purely because we see it in our folder, whereas you will see it in a shared folder. So within yours, you will be in there, you will be under the clinical effect, so it'll be shared folder, clinical effectiveness group, and then within there, you will see a BHR resource publisher, which is this one, and then it's located under protocols. And you'll see it here, CEG template launcher, BHR. It is always updated. So every time a template is updated, this will be updated. So you will notice the version number may change, and that's because we have updated it for you. So once you've got it set up, if you click on it, it's going to give you a list of all of our templates that we provide. So you'll see here, although we have been focusing more on nurse roles, this does cover a lot of the templates for the pharmacists, for your physiotherapists, for your social prescribers. There's multiple templates here that is useful to all of you. And it is the BHR templates as well as your NEL templates. It is an individual user setup or a computer setup. So if you are working on multiple computers, you may have to set it up on each computer that you work. Or maybe it might be a good task if we do have any practice managers on the call today that they could go around and set it up for everyone. Then that way you know that they are going to be using the correct templates to make sure that you get payment for your Lizzies, for your QOF, your DESIs, for all of those things. We are going to be providing these slides and they will have extra slides in it for you. So where we have done live demos, we will put some screenshots in there for you. So even with this, we are going to give you how you need to do it. So you can see here, it's telling you exactly how you need to do it, what the template launcher is called. I did just want to touch back on the templates because I did forget to mention that I don't know if anyone noticed, but we do not put medication reviews in the majority of our templates as tick boxes. And that's because we don't want it to be used as a tick box exercise. We would require that you go to the medication module to review the patient and then enter any information that you need to via the medication module. So just finishing up, what can CEG offer you? So we provide you yearly practice support visits. So this will be around your LISs, the DESs, the QOF, any help that we can give you. We also provide orientation visits for new users. So if you're having new staff join and they need a little bit of extra training, we can happily come along and do that. As Mevish mentioned, we also do personalised APL tool training. And we do provide resource MOTs, that would be myself and Billy coming in if you needed us to go through your old CEG templates and to get archive them for you. We can do that, as well as your searches, because as we well know, as time goes by, we end up with lots and lots of searches within EMIS, and it does then clog up the system and make it run slower. So that's what our resource MOTs are. We provide you your practice support searches, and if we do make any updates, we do always tell you via our bulletin as well. We're providing you all the templates that I've just shown you, plus we provide the protocol alerts that are showing up in your boxes on the right hand side in EMIS, and within System 1 they are either the protocol that comes up in the middle of the screen or your patient status alerts. You've got your dashboards. You will find that there is a dashboard for all of your LISs and some of the DES contracts as well as immunisations. So here's the link on here for you. It will take you to our main landing page. If you're looking for a NEL dashboard, it will be on that first page. If you are in a borough, then you would need to click onto either your Barking and Dagenham, your Havering, or your Redbridge borough before you will then see the LIS dashboards. You've got your tools, as Mevish mentioned, your renal tool, your cancer tool, your childhood immunisations, the AF and the NDPP one. We also hold monthly drop-in sessions. So this is held if you're in Redbridge and Barking and Dagenham on the 3rd Tuesday of the month. And if you're in Havering, it's on the 3rd Thursday of the month. And this is at 12 o'clock. If you are unaware of these, please do get in contact with us. We can get you added to the regular monthly slot, so you'll have the invite sent to you. And then, more importantly, we do provide our CEG bulletin. This is sent every week on a Monday around about lunchtime, and this provides you with any updates that we've made. So if we've made an update to a search, a document or a template, you will find it in here. Plus, it's also a good platform for us to let you know of any clinical information that you need to know, or if we're holding webinars, or if there's any meetings going on, you can find all this information there within that e-bulletin. And like today, we hold webinars. So throughout the year, we will hold different webinars. We did just hold last week, the QOF webinar, so the changes to QOF. And upcoming, once we have advice from ICB of what the changes are for our LISs, we will hold another one around our LISs to let you know of any changes. So if there is anything here that you are unfamiliar with, please do contact your local facilitator and we will get you sorted out and help you with anything you need. Here is our NEL-wide local support team, but as you can see, you've got me and Mevish for your Havering and Redbridge, and you've got Billy and Mevish for your Barking and Dagenham area as well. There is a QR code on here, so you can scan this and it will also give you that information. And that is it from us today. So thank you for all attending. Hopefully this has been very informative for you. If you have any questions after, then please do either put them in the chat or you can contact your local facilitator. So thank you very much for attending.